This is presented by Durham County Library. My name is Victoria Street, and I am a library assistant for Durham County Library at Stanford L. Warren Branch. Today, I will be discussing the library's general recommendations on mental health, anxiety, stress, and self-care for the month of May, which is Mental Health Awareness Month, if you did not know. This list was compiled by my fellow library assistant, Gerard Johnson. Thank you, Gerard. So mental health is often something that isn't explored or is an embarrassing subject to be minimized at best, ignored at worst, unless a current event shoves it in the spotlight. Moreover, there is often a tendency to label those with mental health illnesses as just innately crazy. Which brings us to our first book, Heads Up, which is a book for teens understanding mental health and coping with mental illness, trauma, and recovery. This is a go-to guide for teens that shares the stories of people who are sparking change and shows us that mental health is more than just in our heads. The next book we wanted to talk about is by pastor and psychotherapist Ryan Waller, who focuses on this from a religious angle in the book Depression, Anxiety, and Other Things We Don't Want to Talk About. He addresses the stigma mental health has for Christians, such as things like you shouldn't be depressed because you have Jesus, and exploring the relationship between mental health, faith, self-care, and compassion. Within this list is also a noted focus on the African American experience and the constant assault of racism, both the distant past and the recent, and how it has an undeniably detrimental effect on the Black mind and spirit. The first book we wanted to take a look at was Black Fatigue by Mary Frances Winters, where she explores the physical and mental cause of having always to be on guard. According to Winters, Black fatigue can cause mental, physical, and spiritual ailments that are passed down through generations. She definitely shows the emotional and physical toll of always being on guard and suppressing emotions in order not to be perceived as a threat. While this book remains strong throughout, the call for collective action stands out as Winters asks white people to stop using discomfort as an excuse not to talk about race and implores Black people to resist educating others. The next book we wanted to take a look at is The Protest Psychosis by Jonathan Metzl, which takes this a step further and exploring how psychiatrists in 1960s suggested that Black men that took part in civil rights protests were mentally ill and schizophrenic, thus the sharp spike in such diagnoses, exploring how the inaccurate association of schizophrenia with violence is linked to this period of racial unrest. From a historical perspective, Metz shows that, or contends that race impacts medical communication because racial tensions are structured into clinical interactions long before doctors or patients even enter the examination rooms. He shows how anxieties about racial difference shape diagnostic criteria, healthcare policies, medical and popular attitudes about mentally ill people, and the structures of mental treatment facilities, and ultimately the conversations that take place therein. The next subject we wanted to talk about, or the next book, is the new normal. You know, this past year has seen people adapt to a new normal due to COVID-19. With the mandate of social distancing, for many, there is a greater sense of disconnection and just feeling cut off from loved ones in the world. ABC News chief medical correspondent Jennifer Ashton provides a roadmap to this new period in her book, The New Normal. The next book we wanted to highlight is Together from former Surgeon General Vivek Murthy, who addresses the loneliness this epidemic has caused, noting how human connection is an evolutionary birthright and its physical/mental impact has been huge. With the growing anxiety, there is also a fervent need for solutions, or at least methods for handling stress. Thus, several of these books speak from a self-help perspective, which brings us to another book we wanted to highlight, Are You Okay? By marriage and family therapist Katie Morton, who gives a detailed fact for breaking through the stigmas of mental illness and dealing with several issues, from leaving an abusive relationship to ensuring a potential mental health professional's a proper fit. Our next book we wanted to highlight is The Healthy Mind Toolkit: Simple Strategies to Get Out of Your Own Way and Enjoy Your Life by Alice Boyce, which focuses on helping readers address self-sabotaging behaviors and negative patterns. And the last book we wanted to highlight is First We Make the Beast Beautiful by Sarah Wilson. And this book focuses on challenging cultural beliefs about anxiety from various medical and spiritual leaders, interpreting it not as a burden, but potential for divine growth. And this list is compiled of 21 books. Those were just some that we felt we should highlight. Don't forget to check in with your family, friends, and loved ones, and most importantly, yourself. Thank you for exploring this list of mental health, anxiety, stress, and self-care for May, which is Mental Health Awareness Month. Thank you.